From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours Health System was invited to the White House as part of the Obama administration's celebration highlighting the healthcare industry's energy and sustainability successes. On Tuesday, July 24, 2012, the Obama administration brought together healthcare industry leaders to celebrate successes in increasing energy efficiency and implementing sustainability initiatives that reduce cost and improve patient care in hospitals and healthcare facilities across the country. And Bon Secours was invited to attend. As one of the largest sectors of the American economy, the healthcare industry has significant opportunity to promote sustainability strategies, and hospitals and healthcare facilities throughout the country have devised efficient business models that foster healthier communities and save our organizations thousands of dollars on energy bills. As part of the Healthier Hospital Initiatives, Bon Secours is part of a coalition of major health systems and organizations committed to promoting healthcare and sustainability. The Healthier Hospitals Initiative has enlisted more than 500 hospitals in this initiative to reduce energy use, end wasteful practices, serve healthier food, and promote recycling. As part of the initiative, Bon Secours Health System has committed to improve the health and safety of patients, staff, and communities by implementing at least one of the 6 challenges. Engage Leadership Challenge. Engage in leadership on environmental health and sustainability. Healthier Food Challenge. Serve healthier foods and beverages. Leaner Energy Challenge. Reduce energy use. Less Waste Challenge. Reduce waste and recycle. Safer Chemicals Challenge. Use safer chemicals and/or Smarter Purchasing Challenge. Purchase environmentally preferable products. According to Camille Grippin, Bon Secours Health System's Director of Ecology and Global Ministries, Bon Secours Health System is called upon to bring healing to our brothers and sisters, but also the environment. At Bon Secours, we believe that we have a responsibility to care for God's creations for generations to come. We can do a big part to decrease our environmental impact in healthcare, and HHI gives us a roadmap of how to achieve this successfully. Bon Secours is committed in our SQP to bring communities to wholeness, and the Healthier Hospitals Initiative reflects that commitment. In other news, we've been talking regularly about the new Strategic Quality Plan, our SQP. Last week, CEO Rich Statuto talked about the front page of the SQP. This week, he talks about the back page and one of our 5 goals, bring our communities to wholeness. Let's listen in.
So on the back page, on both ends of the spectrum of the page, we talk about our charism in healthy communities. Our charism is the gift given to Bon Secours, which is God's compassion and healing that we bring to people in need, that we have a special attention to the poor, and that we're helping to alleviate suffering and bringing a message of hope that there's a God that loves them. Our healthy communities really goes beyond the wonderful works that we've done in our hospitals and our physician offices and our outpatient clinics, and it talks about being a participant in the community with the residents, with other social service agencies, with large employers, with the city and the local governments, and saying, what can we do to make this a good place to live for all residents? What are the key priorities to create physical and social environments that promote families, that support senior services? So it's bigger and broader for us to make a difference in our communities. And so the 5 goals that you see are really the framework for what we're going to be doing over the next 3 years. So to bring our communities to wholeness, 2 of the areas that we're going to hold ourselves accountable for and look for ways to measure and make sure we're investing in our our annual plans and budgets. The first is to improve health locally and globally. We want to see at the end of this 3-year period that whatever we select with the community, whatever the neighborhoods are that we're focusing on to improve health, even our employees, what are the key areas that we want to focus on? Is it diabetes? Is it obesity? Is it nutrition? Is it affordable housing? We want to select those critical areas and begin to see the needle move in the next 3 years. The second area we talked about in bringing our communities to wholeness is to build partnerships for population health. We can't do it alone. We're going to have to partner first and foremost with all of our physicians, all of our clinicians, our employees, but I think we also need to move outside of our own walls and start to partner with our payers. Is there a new way for us to really provide value within our communities? And there's a lot of emerging new generation of payment models for ensuring population health.
Next week, Rich talks about extraordinary care. Finally, we've been sharing some of what Bon Secours Healthy Communities initiatives have been doing, and today we continue with Bon Secours, New York. Every large metropolitan area has challenges with getting fresh produce to certain communities known as food deserts. Bon Secours' efforts to overcome those challenges are real, but it takes a lot of good help coming from those we partner with. Here's what I mean.
My name is Boaz Hillebrand, and I work for Bon Secours Healthy Communities Initiative. The idea is to get better food to people in communities that sort of lack access to, high quality, healthy food.
My name is Vanessa Berenstein. I work for Bon Secours Health System in the Healthy Communities Initiative. We're doing community gardening with parents and kids and teaching the kids that are K through 5 how to garden using interactive games to get the kids interested in eating healthy.
My name is Walter Sotelo, and I am the pastor of Inwood Church. Our congregation is primarily residents of Inwood and Marble Hill in the Bronx, a little bit in the Riverdale area.
Hello, my name is Taya Cook, and I'm the Community Outreach Director for all of our programs. A few years back, almost 2 now, someone came up to our boss, Walter Sotelo, pastor of Inwood Church, and said, we know this great lady, her name is Sarah, she works with Bon Secours, you have to meet her.
Oh, the Bon Secours relationship has been fantastic. We weren't really looking for the relationship, but we've been praying for the relationship.
So we sat down, had some dinner, and got to know her a little better. Turns out that she's just so passionate and well-connected. And we had all of these visions and dreams that lined up, and we just hit the ground running.
So our vision is to be able to have a church that it's bringing resources and it's also connecting resources to meet the needs of the people that are living in our community.
As a country, we fund production of corn, soy, a lot of these things that wind up as cheap ingredients and a lot of cheap food. Right. That fact that we subsidize it so much and that it is mass produced so much makes it so cheap that it gets used in a lot of and it gets used to produce very cheap foods, and they're not particularly healthy. So it kind of, when you get into an area like the Bronx, when a lot of people they don't make a lot of money, where they're not they're not wealthy, they buy what they can afford, and oftentimes that's the cheapest.
My name is Jesse Rabinowitz. I'm currently a student at Philadelphia University. Before going to Philadelphia, I was working with the youth markets. The youth market it's like how you have the farmers markets. So this is a youth-led market. The goal of it is to teach youth how to run a business and teach them about the fruits and vegetables they're selling.
My job title is a community food and nutrition educator. So I oversee the cooking demonstrations at the youth markets, coordinating what recipes are going to take place, and I also have a blog to document all the work that we're doing.
We also have 3 farmers markets currently. We have one in Van Cortlandt on Tuesdays, and then 2 on Dykeman. It's on Wednesdays and Saturdays. And we use the youth from the Future CEOs program from last year, have rolled over into this program as well.
See, good help can come from many ways. But when good help comes from a good heart, it makes a big difference.
Bon Secours, New York, using our mission of good help to make a big difference. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.